Megan Fox.
Yeah, Megan Fox has the story.
Megan Fox.
Megan Fox.
Megan Fox writes at PJ Media.
Eat Tucker.
And that was your last.
Damn it, man. I cried for 2 days.
Megan, thank you very much for that.
So, I can explain the bed thing.
If you don't show up and vote, up your ass. I don't care if you're in the hospital. Crawl to the stake. Crawl there.
It's like Jesus going to the temple. He's like, I got a whip. Get out! Get out! The lovely and wonderful Megan Fox. Not that one.
Not that one. Not the weird one that drinks blood in his toe thumbs.
Megan Fox.
Megan. And honestly, Megan, if you don't like it, I'm sorry. She's the devil.
Megan.
Megan Fox.
Megan.
Megan.
Megan Fox.
I've been very nice to you, although I could probably maybe not be based on the way you have treated me, but I wouldn't do that.
You've never met a like me. You want to tangle? You want to go? Holy sh!
Too much cussing on this. I guess we didn't bleep it, so we got to turn it off. But it's
You pissed off the wrong woman.
oh my God, I have been assaulted, but Megan Fox runs wild on you, brother.
She's the devil.
Not for publication.
The story.
I'm Megan.
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 Megan Fox.
Mr.
Thank you. Cheers.
Hey guys, what's up? Oh, whoops, I forgot to take that down. I didn't mean to do that. All right, it's a quiet stream tonight because it's nighttime and people are sleeping. Where the heck is that thing? I gotta take down my law card. All right, here I am. Okay, it's no camera time. It's time to relax. I gotta come up with a new intro for our night streams. I gotta have like a chill one. I gotta come up with something chill. Because that's a little too gets you going. Our night streams need to be like chilled streams. So anyway, I'm in my jammies. I'm gonna fold some laundry. We're gonna watch Dr. Dees because she's terrible, but we're skipping straight to the cross because I didn't learn anything except for the usual dick defense during the direct. And if you want to go back and watch her direct questioning, feel free. You can watch that on Law and Crime or whatever. Christina wants to know, where is it nighttime? I'm on the West Coast. Well, Christina, I'm on the East Coast. So it's nighttime. And my little one just went to bed. So I'm being quiet. We're having a little ASMR. All right. Yeah, I need a lo-fi chill intro for ASMR stream. That's gonna be something I work on in the next couple days because we've been doing these quite often because I don't finish the stream all day because I don't have time to sit here for 8 hours a day. All right, so let's get this going. We are going to start with Mr. Whitney, who is going to cross-examine Dr. Dees. And he does a great job, but this jury does it so much better. I almost think that, like, The plaintiff should just stop doing cross and just wait for the jury.
Can I see that?
Yeah, sure.
You won't be able to read my hand as much as she can. Yeah, that's good. Okay. Go ahead and take a read through your addendum and let me know what you've done.
Dr. Dees, Dees nuts. Dr. Dees nuts. Go team. Thanks, Unhung Hero.
For the 31st or for the first? Because they're both.
For the 31st at the bottom of the page.
Yes, sir. No problem. Okay.
You can hold on to that. I actually have another copy. Well, my question to you is on the October 31st, when you came back on, was it your recommendation to remove the port?
Yes.
And why?
Based on my review of Maya's case, including her physical exam, her presenting complaints, her medical record, both internally and externally, that I had access to, I did not believe that there was an indication for her to have the port. The decision to have a port has to be made based on indications for long-term therapy requiring frequent accessing, frequent IV pokes, frequent treatment, and often is reserved. So for example, patients undergoing chemotherapy, requiring a lot of intensive treatments. In some cases, we may have patients that have central venous access because they've been through so many procedures that they just don't have any good IV sites left. At the time that we were treating Maya and that I was treating Maya, there was no indication for any IV therapy, and there was no plans for any ongoing IV therapy based on the recommendations from our team. So when we're making medical decisions about what is in the patient's best interest, we have to obviously, like anything, weigh risks and benefits. And I really was concerned that the potential risks to Maya, already having seen that she had had that infiltration in that red area prior, the risk of infection, the risk of clotting, which both independently could lead to death, concerned me, that I felt that it was important that I advocate and recommend that the port be removed, because I really thought that the risks were much more than any potential benefit to Maya.
Let me ask you, thank you for that. And I'll come and take the note. So let me ask you about the next time that you saw Maya, which was November 1st, and that's at Joint Exhibit 1001-0369. And at the bottom, what was the interval history?
That the patient was seen earlier in the morning in bed and no acute distress, continued to refuse supplements, and still complained of pain all over, but was seen playing with her stuffed animals.
Okay. Let me take you to the near the end of your note at 0373.
I'm sorry. Did she just say that she was playing with her stuffed animals? So kids in pain can't play with their stuffed animals? It's an indicator to this woman that you're not in pain as a child if you can still play with your stuffed animals. Oh, God, I can't take it with these people.
And then, yes, that if you could expand it down to the second paragraph as well, only the first two.
Oh, you're right. I didn't go far enough. Hold on. It's, this is not cross yet. Almost. We're almost there. This is still Shapiro. Yeah, it's cross after the break. Sorry. Yeah, my microphone might go in and out a little bit because I'm on my computer and I'm on my computer mic and not my good one. So I'll try and keep the talking to a minimum. This is where it starts. Here comes Mr. Whitney.
If we're going to come back to these, but if you could please publish 2277-0068. Dr. Dees, I'll represent to you. This is a note from the risk management file.
Objections Foundation.
Take a moment to review it. Recognize your name on that note?
I do.
And who's the other physician there listed with you?
Dr. Smith.
Mm-hmm. And below Drs. Dees and Sally Smith, it says, okay from risk. Is risk management at Johns Hopkins Health Children's Hospital often making the diagnostic and treatment decisions for the patients?
No.
No?
No.
But you still maintain this is for care and treatment, this EEG video?
Yes.
What does it say there in the diagonal writing at the bottom right? Can you read that?
I have don't know. No. Was there 709?
Let me try.
I'm sorry. I've never seen this before, and it's not my handwriting, so I have no clue what that says.
There it is. Able to do when no one was there. Oh,
Objection
you see that?
Foundation.
Sorry?
Objection Foundation speculation.
Overruled. You can continue.
709 was the room you put her in, right?
That was the room she was placed in, correct?
And this note here is consistent with your rationale, right? You were trying to see what Maya could do when no one was there.
I don't understand your statement. Could you rephrase the question?
Sure. You testified earlier that you were looking for inconsistencies and movements and things that Maya said she couldn't do, but she could do. And the thought was, if you put her in a room without telling her, you'd be able to see things she does when no one was there, right?
That is correct.
All right. You can zoom out for a second, please. And then October 18th and 20th, the third line down, it says on the right side there, I don't know if you can read that, it says to see if she can walk on her own.
Okay.
Consistent with the rationale you had for putting her in this room for 48 hours, right?
Presumably, if that's what that says, my reason for placing her in the room was not specifically to see if she could walk on her own. It was to see if she could perform any spontaneous movement of her lower extremities.
You thought putting her in a room under video surveillance that you would catch her doing something, not knowing the hospital's watching. True?
Could you rephrase that? I'm sorry.
You thought that by putting this 10-year-old girl in this room under video surveillance, you would catch her doing something that she said she couldn't do, but she wasn't aware she was doing while the hospital was watching her.
My intent when putting her in the room was to assess what she was able to do when no one was watching her. It wasn't in an intent to trick her or to catch her doing something. It was to assess what her functional abilities were when she wasn't directly being asked to perform by a member of the medical team.
And yet in all the notes we looked at, there's no assessment following this 48-hour video, is there?
It is included in my total assessment, yes.
By saying no acute events overnight, that's it?
No, it is in my entire assessment of the patient. It is all part of incorporated in there.
Let's go back to the text messages for a second. Again, that's 2116. Let's look at the second page, text 15. If you'll pull out text 15 and enlarge it for me, please. Here is Dr. Sally Smith to you on October 21st, right?
Okay.
And it says, probably already in progress, but get her off as many, there's a typo. Would you agree with me that meds was what was intended, as many meds as possible?
My interpretation, I agree with you that it was probably a typo, and that is probably what she was saying is meds, not mess.
All right. Removing medications from a patient. you'd agree with me that that's a treatment and care decision.
Correct.
Sally Smith's involved in this decision, is she not?
No.
She's not. She's texting you about it, but she's not involved.
She may have recommendations or suggestions, but ultimately the decision as to would be mine as the attending provider.
So you maintain, despite going back and forth with Dr. Smith on medications, that she was not part of the treatment team.
Well, as this text indicated, she suspected that we were already in the progress of doing it anyway. So she's just offering her opinion. She's not telling me what to do.
And you removed those medications too, didn't you?
The medications that were adjusted during my time as her attending physician were part of a discussion with the overall treatment plan and experts such as Dr. Hart, who is one of our consultants, our pain team, etc.
The answer is you removed her from medications during this time, right?
The answer is I would have to review the MAR specifically to know what medications were adjusted or at least refer to my notes.
All right, let's go to the next text message. 16, would you blow that up for me? It says, yep, last med coming off today. Does that refresh your recollection?
Yes.
You did remove medications during this time.
We did adjust medications during her hospitalization, yes.
All right, if we could put up 10010426 again. And just note here, these text messages about medications were on the 21st of October.
Okay.
All right. No, 0426, please. Top line, Maya reported she's having pain all over.
Correct.
And this looks like October 18th. Let's go to 0421, please. About 3/4 of the way down. Maya continues to have pain all over. You see that?
I do.
And this note is from, if you could zoom out for a second, October 19th. If you could go to 0413, please. Complaining of pain all over, about 1/3 of the way down. You see that?
I do.
And this date, if we see it here, October 21st, the same day your text message, right?
Okay.
So you're removing her from medications and she's telling you she has pain all over, right?
Yes.
All right. 0409, please. 22nd, next day, complains of pain all over. You'd agree?
Yes.
All right. 0405. She is hurting a lot. See that?
I do.
The 23rd?
I do.
All right. 0369. You picked her back up in the first week of November, right? As a hospitalist?
Correct.
And here, what'd she say? Complains of pain all over?
Yes.
Can we please put up 2045-024?
You guys, there's something about the shape of her hair, and some of you have picked up on it in the chat. I didn't want to say anything earlier, but it's really bugging me now. You know those wigs that have that they look really real. They have like a hairline and everything. I think this might be a wig. I really do. It's too perfect on the top somehow. It's too thick and it looks too big for her head. Like she looks like she has a lot less hair than that. And it's a pretty decent wig though. If it's a wig, it's pretty decent. And people wear wigs for all kinds of reasons. Maybe she's Jewish. If she's Orthodox, did you know that Orthodox Jewish women they shave their heads and wear wigs? This reminds me of the Orthodox wigs I've seen. And like that perfectly straight part, it's just too perfect. It's just too perfect. You didn't know that about Orthodox Jewish women? When they get married, they shave their heads and then wear wigs. I don't know why. I don't know. I don't know. But it's like a whole thing. All right. I was going to read the super chats because we got a couple super chats. Sharon says she is hostile. She's no friend to Maya. Thank you so much for the $10 super chat. And not a party loyalist, $50. Thank you so much. Red flag for me is all the right words. I'm an advocate. Sepsis can be deadly. Other factors matter, etc. All the call words she should use. All the words I would say in my profession. MHBP gets used all the time. My work equals adults with disabilities. Well, thank you for that. I appreciate that insight. Yeah, I also think it's strange that she won't use words like, um, we took her off of medicines. No, we adjusted her medication. Strange. Oh, yeah, maybe she's wearing a wig for a disguise. Perhaps. Perhaps. I mean, look, some of these witnesses are not going to be very well liked out there, and maybe she doesn't want to be recognized when she's out and about. Those might not even be real glasses. I mean, that wouldn't be a bad idea, actually. That wouldn't be a bad way to go. And I have no comments on, the wig. I think it's a pretty decent one, but I think it's a wig. I do. Hey, the jury finally got what they wanted. They asked for wigs. Wigs and costumes. Yeah, she looks just like Dr. Peppa. I wonder if Dr. Peppa was wearing a wig. Are they all wearing wigs?
-024. You recognize the patient bill of rights for the hospital?
I do.
Would you please take a look at number 19 there? It's at the top right.
Yes,
Maya had the right to have her pain managed, did she not?
she did.
And she told you on 1, 2, 3, 4, 5, 6 different occasions as you were moving from medications that she had pain all over, did she not?
She did.
Who's Dr. Major?
One of my colleagues, one of the hospitalists.
She's a hospitalist on service with you, right?
She was.
And she was at the time of Maya's admission in 2016?
I don't know when she took care of her in the course of Maya's hospitalization, but I do know that she took care of her during Maya's stay at some point in time. Yes.
You worked with her
Yes.
and you traded off as hospitalists on rotation during
Correct.
Maya's admission to Johns Hopkins.
And she was involved at some point in time. Yes.
All right. If we could put up 1002-006, which I'll represent to you as Maya's discharge note. And if you would please pull out the bottom paragraph there. And the third line down, if you'd highlight it for me. What does this say about Sally Smith as part of the treatment team?
Doctor-
Patient approach.
All right, sidebar. The thing about being in disguise is a really good point. See, now look she plays with it a lot too, but look how she plays with it. She doesn't run her fingers through it. She just gathers it in the back and pulls it around to the side. Did I miss it again? There we go. See? Very carefully. But most of the time, like normally you would run your fingers through it, but you can't do that with a wig.
Line again.
It might be real.
So
I
Dr.
don't know. I can't tell from this angle. Now that I'm looking at it close up, I can't tell. Although the scalp mark looks like a different color than her skin. The scalp looks awfully white than her face. But then again, she could be wearing really dark foundation. Who knows?
Dr. Major wrote.
But she looks like she's in a disguise. She really does. She with the glasses and the hair.
That Sally Smith was heavily involved in her care, did she not?
That is what is documented. Correct.
Should the jury disregard Dr. Major's testimony if they hear from her going forward?
Objection, foundation, speculation.
On those two, I'm going to overrule
This one. Argumentative.
sustained.
I withdraw.
1 for 3.
You can take that down, please. Good. All right. No further questions this time.
Are we back to another sidebar?
I'm sorry.
Oh, yeah, you're right. Sorry.
So it's Mr. Shapiro's turn?
Yes, Your Honor.
Thank you, Mr. Speaker. Why are you reducing medications for my pain medications?
That's a great question. As we discussed previously, there were a lot of inconsistencies with Maya's reports of her symptoms, with what she said she could and couldn't do versus what we would objectively observe. When you think of someone that is experiencing 10 out of 10 pain, all over pain, it would be exceptionally uncommon for not only days, but weeks in a row to have that sustained level of pain to where you are simultaneously calm, smiling, playful. So although I absolutely agree, and I'm very passionate about ensuring that our patients have their pain well controlled, we have to have an indication to treat them and their pain. So we don't use, morphine or ketamine or Dilaudid, these big, strong narcotic pain medications, for example, for a scrape, right? We have to assess the patient's reported level of pain against the objective information as to why they would be in that type of pain, and then select pain medication that would therefore treat that type of pain. So because we did not feel as a medical team that Maya's condition was consistent with CRPS, there was not an indication to continue to escalate her pain, especially when she was not observed, at least I can only speak from my own personal experience, having any type of outward demonstration that she was actually in significant pain. I've treated, I don't know an exact number, but thousands of patients over my career. And when we're...
Let me redirect you this. The decision to start and stop pain medicine,
Yes,
was that made by you?
that was made in collaboration with our pain specialists and physiatrists. Yes.
And the pain specialists and physiatrists, those are the all children's employed pain specialists?
Yes, sir.
Okay. In going through the chart, have you seen a single order from Dr. Sally Smith in that chart?
No.
So if the jury goes to the medical record of all children, they're not going to see Sally Smith's ordering anything for this patient, is that right?
I obviously would have to review them all personally, but I am not aware of her entering any orders directly in this case.
Why are you?
Did I accidentally jump backwards? Why are we on, what's his name? Oh, for crying out loud, how did that even happen? We were on Whitney's. Oh, did we? Oh, this is just, okay, we didn't get to jury questions yet. Well, I'm skipping, what's his name? I don't want to hear Shapiro.
18th progress note. Why is pain, quote, all over, end quote?
Hold on.
Mr. Altenburn, is Mr. Elligott going to be joining us somehow, or? Okay, everyone please be seated. Members of the jury, just want to confirm while you're away, you did not discuss this case amongst yourselves, you did no investigation, and did not receive any information. Is that correct? No one approached you? And didn't see anything about the case, correct? Okay, Dr. Dees was out of our presence, so this will be the first time she's hearing these. There's a number of questions. Did you testify that it was your idea to place Maya under video surveillance?
It was my decision, yes, to move forward with the video surveillance.
Why did you ask Dr. Smith how long she wanted to keep Maya on video?
Dr. Smith also had recommended video surveillance for her kind of, I guess, forensic or legal portion of it. And so I had reached out to RISC because I was unfamiliar with that portion of it. Certainly it made sense to me for us to both complete our portions of our investigations and in a kind of coordinated and simultaneous way rather than like moving her back and forth. So that's why my portion, I felt that I had enough information to help me with my decision making.
Okay, I have to say something. She keeps using the word investigation. She said our investigations, our separate investigations. So Dr. Sally was doing her investigation and I was doing my investigation. Why are you investigating this little girl and her family? You are a doctor. Your only role is to treat your patient. You're not a cop. You're not a county social worker. You're not a child abuse doctor. You are a hospitalist. And I can't believe the jury did not seize on this, because if I were there, I would have said, why are you investigating one of your patients when there was already an investigation going on by law enforcement and the county? Isn't it your job to treat your patients and not investigate? Who gave her investigatory power? Who gave her, Dr. Dees, investigative power in a hospital? And listen to how many times she uses the word investigate.
But just needed to ensure if she was also done or if she needed more time for the legal portion of it.
You also texted Dr. Smith asking her if she wanted to review camera footage from Maya's surveillance. Why?
Because she had requested the surveillance as part of her legal case and forensic case.
Who was on the care team with you?
So those would be internal providers at Johns Hopkins All Children's Hospital. So everyone from myself, my consultants, my residents, our nurses, our physical therapy, occupational therapy, pain team, all of our internal providers that were part of her care team.
Does CRPS pain change daily?
Presumably it can, of course, yes.
If Maya complained about having pain all over, how does Maya dress herself?
That's a great question. I can't answer that on her behalf.
The October 18th progress note. Why is pain, quote?
Okay, sorry, that pissed me off. Obviously, that question is not currently today. How does she dress herself? And I wish the judge had gone back and said, no, I think they mean, how did she dress herself in the hospital when you were there? Obviously, you must know, how did she get dressed? And I bet the answer is the nurses helped her get dressed.
I can't answer that on her behalf.
The October 18th progress note. Why is pain, quote, all over, end quote, in quotes?
So when we're teaching our residents about involvement in cases that are, child abuse, medical child abuse, neglect, sexual abuse, things like that, where we understand that there's a high likelihood that there will be, court proceedings, legal things, we try to explain to them that it's important to not interpret a patient's symptoms and document their interpretation of the patient's symptoms, but to simply ask them the question and then put their response in quotes, because we want to make sure that we're not changing what the patient reports and that we're just factually gathering that information and then reporting it as they've stated it.
Were you presupposed to doubting Maya?
No.
How many CRPS patients, pediatric patients, had you treated before Maya?
I don't have an exact number. I would say it's hard to kind of extract the past 6 years of experience that have passed, or 6, 7 years. I would say at least a handful at that time, if not 2 handfuls, but it's maybe 5 to 10. I'm not exactly sure, but
I don't believe her. How the hell does she not remember how many pediatric patients that she has seen with CRPS, this very rare disorder, and she has no idea? It's between 5 and 10. No, I bet none. And also, what a jury question. Are you predisposed to disbelieving Maya? And she says, no. Everybody knows the answer to that is yes. You just spent your entire testimony on direct saying that you didn't believe her, that she told you she was in pain 4 times in one day, and you did, but we didn't see any signs of pain. So we didn't see that there was any pain. She wasn't exhibiting any pain. This woman makes me angry. Angry. I mean, it's just, can you imagine your kid being at the mercy of somebody like this, who is busy investigating you and her instead of treating her?
More than just Maya, certainly.
How many CRPS pediatric patients have been treated at All Children's Hospital before Maya?
I don't know the answer to that question. I'm sorry.
Next question. Would you be willing to admit that sometimes staff in high-stress service jobs develop family-like relationships, supportive of one another as the work is arduous and prolonged?
That is certainly a possibility. Yes.
All Children's Hospital has had a number of long-term staff members and even ancillary service members who seem, parentheses, Sally Smith in parentheses, to have, quote, deep roots, end quote, at All Children's Hospital. How would you describe these relationships as almost familial?
I'm not sure I'm understanding the question. Is the question asking that there have been a lot of staff members that have had longevity at the hospital, and how?
I'll tell you what the question means. You ready? You ready? Here's what it means. We notice that a bunch of you have been there a really long time, and we think you're covering each other's asses for one another because, just face it, admit it, you're like family. And what does family do? Family sticks up for one another. Family covers up for one another. Family lies for one another, don't you? That's what it means. The jury's onto them. At least this juror is totally onto them. She sees, or he sees, that Johns Hopkins has a bunch of people who've been there for many, many years, and they like their little setup, and they don't want anybody coming along with a $200 million lawsuit to ruin it.
How do we interact with each other as a family? I'm sorry.
I think for follow-up, if the lawyers feel they need to, or if the jury feels they can follow up, they can, but I'm just reading it as it's.
Do you mind repeating it to see if?
Sure. All Children's Hospital has had a number of long-term staff members and even ancillary service members who seem, parentheses, Sally Smith in parentheses, to have, quote, deep roots, end quote, at All Children's Hospital. Okay. How would you describe these relationships as almost familial? Or maybe it's, would you describe these relationships as almost familial?
I can only speak from my personal experience being a physician that not only trained as a medical student, I did a rotation at All Children's, then completed my residency training, then have stayed on as an attending. From my own personal experience, I can't speak to Dr. Smith or on behalf of other members of the medical staff. Some of my very best and dearest friends are colleagues. Absolutely. One of the things I'm most proud of working for Johns Hopkins All Children's Hospital is the caliber of physicians, nurses, consultants, team members that work in our institution. Everyone is committed to taking care of kids, doing it in a high quality, evidence-based and compassionate and family-centered way. We definitely all support each other.
I'm sorry, did she just say in a compassionate and family-centered way? What does she take us for? Morons? You're a family-centered, compassionate place? You tore a family apart. You drove a woman to suicide. No, no, no. You don't get to get up on the stand and say how compassionate and family-centered you are now. No, you investigated your patient by your own testimony instead of treating her. That's terrible. Terrible.
Each other and are there for each other. But I have never had concerns about boundaries of personal relationships compromising our professional integrity or compromising our ability to remain objective in the face of a challenging case, for example. So I hope that answers your question.
Did you observe Maya being denied religious ceremony?
No, never.
Did you ever hear about Maya requesting religious ceremonies?
No, not to my recollection, no.
Is it within normal expectations that most kids struggle to eat hospital food?
Well, so in theory, hospital food usually is thought to be unpalatable, but I do think that we have, we're a pediatric hospital. We're pretty friendly towards, we've got ice cream and milkshakes and cookies and stuff like that. It's not like, I guess, what you would see on TV where it looks like a TV dinner and it looks like it's this frozen, horrific reheated mess. So absolutely, are there some kids that...
Ma'am, we have not seen that on TV. We've been in hospitals, and we've watched our relatives have to choke down hospital food. It's not that they've shown it on TV. We've literally been there. We have people in the chat right now who are in hospitals. Someone is in the hospital right now with his dad. And I bet the hospital food there is damn near inedible, like it is in every hospital. It's a damn joke, and we all know it. And she's going to try and tell us now how great the food is at All Children's. Wait till you get to the part where she admits they're serving kids SpaghettiOs and Pop-Tarts in a freaking hospital. You think that maybe they could go with fresh fruits and steamed vegetables, or some stir-fried vegetables and some grilled chicken and, healthy things that would make you better to feed. No, they're serving these poor little kids SpaghettiOs and Pop-Tarts. I say lock them up just for that.
Don't like our food, of course, right? I mean, everybody has their own personal preferences, but have I seen kids order SpaghettiOs and Pop-Tarts for breakfast and they're sitting there eating it like it's the best combination, and I'm sitting there nauseous because I don't understand how they could possibly eat that combination?
Why do you have it on the menu in a facility that proclaims to be healing people? Why would you serve canned preservatives, food dyes, and empty calories, sugar, and Pop-Tarts, and oh my God, why would you even serve that on the menu?
Of food, that too, right? So it just depends. But
the reason they're eating SpaghettiOs and Pop-Tarts is because that's the best thing they could find on the menu.
Each case is so different and each child is so different. So it's kind of hard to make a global assessment of that.
Did Maya struggle to gain weight and consume desserts?
I don't know about desserts specifically. I remember she was eating a lot of graham crackers from my notes, but I don't know specifically more than that about desserts. There was a history of struggling to gain weight, but she did have improvement in her weight during the hospitalization.
Shame.
What kind of oversight did a hospitalist have over Kathy Beatty's position, if any at all?
So the social work department has their own reporting structure, and we are not responsible for the oversight of their standards of care, professionalism, conduct, proficiencies, et cetera, anything like that. They are certainly the social workers are an invaluable part of our teams, but we don't have a direct responsibility to monitor or evaluate or ensure their practice standards, if that makes sense.
As the coordinating hospitalist, did your work require you to interact with Kathy Beatty?
Yes.
Does a child's overall treatment in the hospital have an effect over their recovery and length of treatment in your experiences?
Do you mind repeating the question one more time, please?
Sure. Does a child's overall treatment in the hospital have an effect over their recovery and length of treatment in your experience?
So that's a difficult question to answer because there's so many different diagnoses that I treat as a hospitalist. So I can treat anything from asthma to pneumonia to seizures. I, on a daily basis, treat kids with multiple chronic medical conditions like cerebral palsy and, dysphagia, to where they have gastrostomy tubes and feeding tubes. So it's really hard for me to think of all of my patients as one to be able to answer that question, because there are some kids that absolutely, without coming into the hospital, would not get better on their own, right? And so I feel like we help them recover more quickly. There are certainly, I'm sure, some cases where there are prolonged hospitalizations that dynamic being away from families, which of course is stressful and hard, being away from their support networks, that I could definitely foresee where there are situations where maybe that could impact their path to recovery. But overall, of course, and that's our job, is to try to help them. We want them to get better and to get them back home or wherever it is that they came from. Some kids come to us from skilled nursing facilities and we send them back there. But our goal is to get them medically stabilized, make sure that there's no longer need for acute inpatient services before we transition them back to where they are, so that they can continue to thrive and do all the things that we love to see kids doing.
Next question. What floor did you work on take place? And I'm assuming that means when you were with Michael.
So my general areas that I work in the hospital are the 7th and 8th floors. That's where the majority of my patients are. Occasionally I have to go see patients on the 2nd floor, which is like our perioperative areas. We go down to the EC to consult on patients or to admit patients. I'll go down to the ICUs to transition patients either in or out of the ICU. But my main kind of domain or territory that we typically practice and round on are the 7th and 8th floors.
Who was the Kathy Beatty of those floors?
The social worker that covered the 7th.
I love that question. The Kathy Beatty of that floor. Who is the Kathy Beatty of that floor? That's like the jury has turned Kathy Beatty into a larger than life villain. Like, she's so important in this that there are Kathy Beattys running around on every floor. And the jury wants to know who's the Kathy Beatty on that floor. We want their names. We want to know all of them. Turn all your Kathy Beattys over to this jury.
And the 8th floors.
Yes.
I'm sorry. I don't know that I'll be able to remember people's names that far back. I believe Yvonne Walton was one of our social workers that I remember interacting with a lot during that time period, but I don't know that I can remember anyone else's name. I'm sorry.
Do these positions normally stick to a patient on multiple floors?
It's possible. So it depends on the patient and the diagnosis sometimes. And the staffing models for the social work department have changed over the years when I've been there. Sometimes it's kind of diagnosis specific, where they follow a cohort of patients, right? For example, our neurosurgery patients, regardless of whether they're in the ICU or in the OR or on the floor, that same social worker potentially could follow them. So it is possible that at different times there are different models. Sometimes it's strictly geographic. If you're on this floor, that's who sees you. Sometimes it's population based. So I'm sorry, I can't remember what it was at the specific time that Maya was with us.
When you switch a patient from room to room, do you just move them and there is no explanation or reason given to the patient?
So I would assume that when we are moving them for...
Okay, this goes really bad for her. The jury question was, in case you weren't paying attention and you were looking at the hilarious chats, stop looking at the chats for a second and listen, because this goes bad for her. The question is, when you move patients from room to room, do you tell them why you're moving them, or do you just drag them out of their room and put them somewhere else? This jury is killing me. And listen to her answer, you guys.
Or like a clean and there's a family there and they're asking, that we would certainly have no problem sharing that type of information. As I shared earlier, I think Maya's case, however, is a little bit different, because in her case specifically, alerting her to why we were moving her could have potentially changed her performance to where it would not have helped me with diagnosis.
So in other words, they dragged Maya around that hospital and they never explained to her why she was always getting moved from room to room. And on top of being removed from her family and no one telling her anything about any of it. And does she think this jury is going to think that that's an okay answer? It's an okay answer to say, oh, we had to lie to Maya because she was under this horrific order by the court. And so we had to make her life even more difficult by not even making up a suitable lie about, well, we're going to clean your room today, so we need to move you someplace else. So that she wasn't terrified and anxious? Wow, lady.
Do the nurses or staff not use gait belts for fall risk patients?
Oh, that's a great question. I'm not sure. I have seen them used. I don't know what our standard, like if there even is a standard practice or policy on the use of gait belts versus recommendations from our therapists about, walkers or other modalities. So I'm not sure if that's a particular standard.
We have heard testimony CRPS is a rare disease. You testified you have treated many patients with CRPS. How many patients had you treated with CRPS prior to treating Maya?
So I believe I answered that previously. I don't know. I've never pulled records to know exactly, but I would guess probably in the 5 to 10 range prior to treating Maya, and many more since then.
We have heard testimony staff at All Children's Hospital had nicknames for the plaintiff. What was your nickname for Maya?
I don't recall ever having a nickname for Maya.
Do you think it's appropriate to call Maya Ketamine Girl?
I certainly, think that.
Oh, that's a lot of stuttering. Let's go back, shall we? Let's go look at her face.
Do you think it's appropriate to call Maya Ketamine Girl?
Ooh.
Do you think it's appropriate to call Maya Ketamine Girl?
Shakes head, presses lips together. She knows damn well it is not appropriate.
Certainly, think that that's probably not ideal. However, knowing the physicians that were, caring for her prior, I don't have any questions about their integrity or their ability to provide compassionate care, even if they were choosing to use nicknames to not divulge, her protected information when they were messaging. And certainly that's not something that I would anticipate that anyone would use that terminology to the patient or her family.
Well, we wouldn't call her that to her face, so it's fine if we do it. Do you think any of these people are ever going to get the idea that the one time when the jury has asked this question to multiple witnesses, the only answer is it is not appropriate. It was not appropriate, and no one should have done it. No one should have done it. And that's the only thing you need to say. Holy crap, these people.
How often did you communicate with Kathy Beatty about Maya and her needs?
I don't know that I would be able to quantify the exact number of times that I spoke with Miss Beatty, but as the social worker, I do remember her being involved in certain points of time during Maya's care. So I don't, of the maybe total of 14 days that I took care of Maya, I don't know that it was daily, if that's helpful, but certainly several times within a week. It would be important for me, for any patient that's under shelter order and that, has been sheltered by the state, for me to keep in contact with my social worker to understand what the most recent, hearings or procedures are happening, because our social workers are our conduits to the child protection team, to the.
Okay, sustained. Let me go to the next question. How involved was risk management in Maya's care and treatment?
So risk management was not involved in making decisions on what treatment or diagnostic testing or diagnosis, but they were the only contact that I can recall having with them, specifically when I called them because I wanted to place Maya in the video room, but Dr. Smith also had similar goals, and I wanted to ensure that there was no problem with us having parallel and simultaneous goals at the same time, since she is technically external and was not part of the treatment team.
Did risk management stay up to date with what was happening to Maya?
I'm not sure. That's a great question. I'm not sure how they interact, like if they only just wait for someone to call or if they're monitoring the case. I'm not sure what their practice is. I'm sorry.
Are you aware if upper management was aware of what was happening with Maya in your hospital?
I know that I had contact with what I would perceive to be upper management without a definition on at least one occasion during the 2 weeks that I took care of Maya. I'm unaware beyond that specific contact that I had, if they were otherwise involved or aware or following the case.
How long did Maya receive Haldol while at All Children's?
I would have to refer to the medical record for that. I don't know that off the top of my head.
Even though Dr. Sally Smith did not enter orders, she could make suggestions to the team, could she not?
Yes, she could. Ultimately, as the attending provider, it would be that attending provider's decision whether or not that was appropriate and reasonable to perform as part of Maya's evaluation and care.
Sorry, please finish. I apologize.
No, you're good.
Were you finished?
Yes.
And I apologize if I was too quick there. You testified you did not make mention to the patient or parents that Maya was being moved to a video observation room because in initial hospital sign-up papers, it is already agreed to that the hospital can do as part of the hospital's treatment. Is that correct?
Correct. And also, in addition, because the purpose was for me diagnostically to be able to evaluate her function, if I told her that we were specifically moving her to that room to monitor her, if there was any element of conscious control of what she was doing or not doing, then I was very concerned that it would be counterproductive and that she would therefore be able to be aware that she was being monitored constantly, and therefore it would not be a true reflection of her function and more.
We were concerned she would be aware we were investigating her. Oh, that's a good screenshot. Look at this, is perfect.
More of her conscious effort.
Okay, when you move a patient from a room, let's say to the x-ray room, do you let them know, or because they are already agreed to treatment, you wheel them around without explanation?
No, I mean, again, we want our patients to be aware of what's happening and where they're going.
The jury hates the fact that they have done this, that they wheeled her out of her rooms. They constantly changed the room she was in, and they don't like it. The jury doesn't like it at all. This is not going to go well for her. Watch this.
Not meant. Typically, we want our patients to be aware of what's happening and where they're going. It's not meant to be, in pediatrics, we are always hyper aware that not only are the patients, children, anxious about what's happening and what could be happening, even if we come to do a procedure in their room and not wheel them anywhere, we always want to be very mindful of their level of anxiety so that they're aware of what we're doing.
But not Maya. We didn't treat Maya with that kind of deference. Not Maya. Because we were investigating her. And wait till you hear what she says next. It's going to truly make you fall out of your chair.
However, in this particular case, it was different strictly with the EEG monitoring, because if we had alerted her, it could have altered and impacted the results of my investigation.
My investigation. And wait, didn't she say, I have to back up and hear that whole thing? Because I think she made reference to when there are families there, we alert the families. Oh, well, in this case, though, you took away Maya's family. Look at that face. Look at that face. That might be the one going on the Munchie Bunch.
Wheel them around without explanation.
No, I mean, again, we want our patients to be aware of what's happening and where they're going. It's not meant to be, in pediatrics, we are always hyper aware that not only are the patients, children anxious about what's happening and what could be happening, even if we come to do a procedure in their room and not wheel them anywhere, we always want to be very mindful of their level of anxiety so that they're aware of what we're doing. This, however, in this particular case, it was different strictly with the EEG monitoring, because if we had alerted her, it could have altered and impacted the results of my investigation.
At the time you encountered Maya, how many years had you been a doctor?
So I graduated from medical school in 2008, and then I took care of Maya in 2016. So for 8 years.
In your time as a doctor up to the time you encountered Maya, how many patients had you examined and given the diagnosis of CRPS?
I don't have enough recollection of the previous cases specifically prior to Maya in terms of was I the one to deliver the diagnosis of CRPS. Typically, when we're evaluating patients with suspected CRPS, we have a multidisciplinary team, right? Where we may have specialists involved, whether it's neurology, physiatry, rheumatology.
Yeah, you bet. You bet it's non-responsive. And let me ask you something. Do you really believe that this woman wouldn't put it on her resume if she had diagnosed a rare pediatric case of CRPS? She hasn't diagnosed shit. She hasn't diagnosed anybody with CRPS, or she would know. This is so much garbage.
No, you can finish the answer.
So, and maybe I'm being too literal with the question, but I don't remember, I can't tell you a number of the patients that I was involved in making the diagnosis or treating patients that already had CRPS, if I was the one that like delivered or made the diagnosis, so to speak. So it's, I guess the short way to answer that question is I'm not sure how many I have personally been the one to diagnose.
Please clarify requesting Maya be transferred to the, quote, seizure monitoring room, end quote. That was not because Maya was having seizures.
Correct. So the video equipped rooms are in our seizure monitoring unit. So it's a virtual, I guess it's kind of like a virtual unit where it's on 7 North. 7 North has maybe 28 beds. And I believe it's rooms 701 through 709, 710, something like that are outfitted with the cameras for remote video monitoring. And so that's called our seizure monitoring unit. Those are the only rooms that I'm at least aware of in the hospital that have any type of remote video capability. So the order in the system, when we're trying to designate that we needed to move her into one of those rooms, there are certain options, and that's just the option that we would use to designate that we needed her in one of those rooms. But you're right, it was not for concern for seizures per se.
Sally Smith texted you with what you say is just a suggestion about taking Maya off of meds. You also stated Dr. Smith is not part of the, quote, treatment team, end quote. Then the jury is shown a text, I believe from you to Dr. Smith, responding something similar to you are or have you responding by virtue makes Dr. Smith a team player. So is she or is she not part of the team, the treatment team of Maya?
Okay, so that was a poorly worded question. But the jury was just shown an email that called all the people who were copied on it part of the pain management team, or the pain team, or Maya's treating team. And guess who was on it? Dr. Sally Smith. So that's what they're referring to, is that email they saw, and she's going to lie her way out of it.
I think the best way to describe Dr. Smith's role is that she is an external consultant. She is an expert in child abuse, neglect, abandonment. And in this case, we were concerned and suspicious for medical child abuse. So as the lone and only child abuse specialist in Pinellas County, she was a consultant that was part of the legal process, so to speak, that was involved when you have a patient where you're suspected that they are a victim of physical abuse, medical child abuse, sexual abuse, etc.
Objection, relevance, non-responsive.
Why don't you go ahead and finish your answer?
Okay, so
But I'm assuming it's pretty close to being finished.
yes, so she was not part of our internal treatment team. She's an external consultant. That's the short answer.
Mr. Shapiro.
One question. The role of Dr. Sally Smith in this case was as director of Pinellas County Child Protective Services?
Correct.
Okay, thank you.
And
I'll be quick. I think the jury will start throwing things at me. You talked about internal providers. Sally Smith had access to Maya's medical record, right?
Yes, my understanding is she did.
She had staff privileges, right?
She has staff privileges in 2 different capacities. So in which capacity are you asking?
As a physician. Staff privileges is an active staff member at Johns Hopkins Hospital.
In addition to her role as CPT, she is a local community pediatrician that has admitting privileges to see her own patients. I don't know the difference between her access in her role as CPT and medical director for the child protection team versus her ability to access the chart as a physician with admitting privileges, because her practice admitted their own patients, just general pediatric patients, not involved in the legal process.
She was on executive committees at the hospital, right?
I don't know her committee involvement, I'm sorry.
She was the residency rotation director at the hospital, right?
I am unaware of Dr. Smith being a residency rotation director.
Would you agree with me that hospitalists, of the physicians involved in a care team, have the most hands-on contact with the patient?
Not necessarily.
In Maya's case, would you agree with me that the hospitalists are the most constant presence of any physicians?
During the time she was on the floor, yes.
And you testified that we, and I think you said we, you mean the hospitalists, were not supervising the social workers, right?
Our responsibility is not to supervise these social workers, like performance, training, things like that.
No further questions.
No, thank you.
Okay, and members of the jury, okay.
She looks real thrilled at the prospect of getting another question from this jury, doesn't she? Is the jury smiling at Jack? Is that what is happening here? I wonder who he's looking at. I think the jury might be smiling at Jack now and then. I have noticed him looking in that direction and smiling like he's returning a smile. That's always a good sign. If they're making eye contact,
Unfortunately, that's.
Oh, they're not going to be able to ask this question. Okay. All right. Well, then the rest of it, I watched the end with the whatever the arguments were. I don't remember it being anything that interesting, so we're not going to go over that. I'm going to, get some sleep. But thanks for hanging out with me. And oh, maybe Jack's flirting with one of the jurors. Flux thinks, I feel like a lady might be giving him the smile. He does not look creepy with that pink tie. Pope Rackets touched me. That's not true. I like the pink tie. All right, let's see. I'm catching up on your comments. Okay, Dr. Sally Smith is taking the stand on Thursday. Is the plaintiff going to have enough time to cross her? Yes, I'm sure they will. They're going to have to just barely talk tomorrow, and then they have to wait till next week because Kathy Beatty. Do you see what the defense did? They saved all the good ones for the very end. Kathy Beatty is being called in. I can't believe they're going to call her. The jury very clearly hates her. If I'm the defense, and I don't want to give them any ideas, but I don't call her to the stand. No, no, no. Nick, you think they have nearly 7 hours, but it's not a lot of time. They took up 1 hour and 40 minutes today. an hour and 40 minutes. So I think they're going to pull it off. I'm not saying that I don't, but I think, yes, I think don't do the cross on Sally. Just let the jury guide you and let you know what they want to know, and then you go in afterwards. That's what you do. Oh man. So far, I think the jury is still leaning plaintiff. But I did notice a few questions to that quack expert today, um, that I felt were kind of concerning. But I personally, I wish I could give my own closing arguments in this thing, and I probably will. I'm going to probably do my own closing arguments because part of my closing arguments would be it doesn't matter if she has CRPS or not. We know this was a kid in pain. Her parents are seeking answers in good faith. They love her. There's never been any allegations of abuse. They have no evidence that her mother ever abused her. And all the medical treatments she went through were given to her by treating physicians with licenses. So if there was a problem with those treating physicians, then somebody in law enforcement needs to go after them and not this family. And the hospital did wrong. They investigated this family instead of treating them. And they are wrong. Jingleberry says 20% of my closing would be straight yelling. You know what else I would say? I would say, and if you, members of the jury, ever want to go into a hospital and feel safe again, you will deliver justice to this family so that other hospitals get the message that they are not to treat you like this, that they are there to heal your pain, that they are there to listen to your complaints and not treat you like some kind of criminal. And if you want to go into a hospital ever again, make these people pay and make them pay big. Yeah, that would be part of my closing. Send a message. Send a message to every child abuse doctor out there who thinks that they can be sloppy in their accusations. Make them think twice. Oh man, I'm so tired of it. How you doing over there, Rumble? Rumble's doing okay. All right, guys. I'm getting out of here. I'm not gonna leave you with the big shouty ending song. Duncan says, still eagerly awaiting the verdict watch along. I know, but we may have to wait till this trial is over because I just haven't had any time. Every time, where I'm just streaming this trial all day long, and then I'm tired. Yeah, oh right. That has to go in the closing arguments too. They threw Jesus in the dumpster. That alone deserves at least 100 mil. All right, let's see. I am looking to see what I can leave you with. Can I leave you with anything? I'll tell you what. We'll just play a little nice soft music. All right, that's a little creepy. I don't like that. How about this one? No, that's so creepy too. I don't know. I don't like this music, but it's okay. It'll do. Good night, everybody. See you tomorrow.
I don't know how to put this, but I'm kind of a big deal.
Really?
People know me.